Lagos Traffic Radio 96.1 FM. I mentioned earlier that at 4:30, it'll be time to join me on Health Insurance Today on radio. And of course, here we are. Welcome to this week's edition of Health Insurance Today. Of course, Health Insurance Today on radio, the show that educates and brings you the latest information on everything health insurance. This program is brought to you courtesy Sister Communications Limited, and I am your host, Taiwo Baruwa. Last week on the show, we discussed the topic, the silent killer, understanding hypertension, during which a cardiologist educated and enlightened us about hypertension, its management and prevention, and how having a health insurance plan can help to handle a bit of a more cost-effective way of managing the condition. And we thank you for your calls, feedback, inquiries about that episode. We hope to, of course, we hope you learned one or two lessons from that edition. On the show today, we shall be discussing My Health Insurance. That's a story and, of course, a testimony of a user of health insurance, which is an opportunity for a subscriber to share his story on having and using a health insurance plan. Our guest is right here with us in the studio and is going to be sharing his real life story and also enlighten us on health insurance. Remember that you can be a part of the conversation. You can call the studio line on 0915-387-7127. I'll take that again, 0915-387-7127. You can also send a text or WhatsApp platform just if you're not able to reach us via telephone call. That will be on 0809-9120-777. Quickly, before we get down to business, let me remind you that most of the areas we're tracking at this time are looking very good. Kudu at Abiola way, you have it looking okay. Just a bit of slow movement connecting Ojota proper, the welfare intersection, Clay, and the likes, all looking very good. Obafemi Aolo way, amazing this afternoon. Likewise, the stretch of Latif Jakondi. Of course, you have to slow down intermittently approaching the major intersections along that stretch. But note that the rehabilitation work on Ifako Bridge is still ongoing, and certainly you would have to slow down. The build-up is just between Hayden Filling Station, Iwadogudu, connecting Ifako. So just be patient navigating that area. We'll be touching some other parts of Lagos. Just if you get cut up anywhere, you can share with me so we escalate from here by sending a text to our WhatsApp platform. I mentioned earlier that my guest is very much with me in the studio. I have Adeolu Adeomi. He is a director of organizational development at AT Limited, a human resource consultant and marketing services firm here in Lagos. Welcome on board, Adeomi.
Thank you for having me.
All right, good to have you in the studio. Can you tell me a bit more about your background, how you decided to, tap into health insurance? What prompted that decision for you?
Well, health insurance to me has not been new. It has always been something that I know since my university. Fortunately for me, the school I went to, it was mandatory to pay an health insurance at the beginning of every session.
Oh.
Yeah, so once you pay that, no matter what sickness you have, you just go to the school clinic and you get treated for immediately. So that was the first introduction to health insurance. At first, when it happened, I was like, what are we paying this for? But along the line during the session, when you see that you need to be admitted or something, and you see how you don't have to be bothered about whether you are broke at the end of the month or something, whether you don't have enough money, you get free medicals. Not necessarily free medicals, but you get taken care
covered.
of. Yeah, you get covered completely for whatever ailment it is that you have.
All right then. So tell me, what type of health insurance plan did you subscribe to? And is the government scheme, is it a government scheme or a private HMO plan? And how long have you been a subscriber to it?
So I've been like since 2010. I've been a subscriber to, but they've all been private since 2010. From school, it was always private. From when I started working, I think I started working in 2015. It has always been private. I've always had the opportunity to use HMOs. Let me just put it like that, HMO. So it's always been private, and till today, to this moment, I still use them.
All right then. So does this plan cover just you or your family members? And how are these family members related?
Well, at the moment now, the plan I'm using right now covers me and my wife. But before I got married, it was just me. Like you said, I am the organizational development of an HR firm, so I have HR experience.
Okay.
And my HR experience, I've worked as an HR in an organization before for a long period of time, and I've seen people that it covers their family, it covers just them. Some people even want you to cover like their, let me use the word, not their husband, but the father of their baby, because they don't have the same surname.
Okay.
Yes, but they want it. That's how important it is.
Okay, that was why I asked you earlier that what's your relationship with those it covers for you. I just wanted to have an understanding of how it works. Do you have to bear the same surname with the person you're bringing on board?
Well, it depends. The truth is that it depends on the organization, or it depends on if it's just you're the one who's going to subscribe on your own. If it's from your workplace, most of the time your work might demand that the person that you are adding to the HMO plan, there's a proof that the person is family.
Okay.
So I just don't have any random
person.
Yeah.
All right then. Since you subscribed, then what specific service have you, your wife, and children enjoyed on your health insurance plan?
I've enjoyed. I don't want to say enjoy because nobody prays to be sick or anything like that. But I've used the service. Like, I'm someone that, like, let me say I abuse health insurance plan.
Oh, wow.
Let me use that word. Like, if I sneeze like this, I'm going to the hospital. Yeah,
Mm.
I've used it to get glasses.
You're not abusing, you're paying for it.
Yes, what I'm saying is that if you talk to my current HMO officer that is handling me, she'll tell you that she's tired of me because I call her every time, like, oh, I need to go to the doctor today. Oh, I need to go today. I need to do a checkup. Like, I do monthly checkups. I do the regular checkups, obviously, but it's not monthly actually. It's like every 3 months I do a checkup. My wife does her own checkup also. I once had an injury about 7 years ago in my hand that required surgery. It was HMO that covered it. And that's been the experience with HMO for me.
Okay, for some people now, it's not a necessity for them. Can you share with us a time or experience when your health insurance plan really made a difference for you, your family? I mean, that made you realize the value of this health insurance plan?
Okay, so I want to address, I think you asked two questions in a way. I want to address people that I think is not necessary. It's extremely necessary. One of the reasons why it's necessary is because of the economy that we have today, the economy that is not very stable, if I must say. So once you are able to pay for it, you don't know if at a particular point in time during the course of the period that you've paid for, if you might have enough money to cover your hospital bills when you come in with a particular sickness. But if you've paid already, you can just go in and then you get treated for. I won't share a personal story, but it's not me directly, and this is just recent. My cousin passed away about last week, which is quite sad. And the unfortunate thing about it is that, assuming he had healthcare plan, he won't have died. It's as simple as that, because he was self-medicating, and assuming it was because of I don't have enough money. When we got to find out, like, they were self-medicating, calling all these local nurses in the area to give them drip and all of that, and not going for the right and proper checkup, that's a life that was lost due to just not subscribing for health insurance, just to be able to take care of yourself. and look out for yourself. For the other question, sorry, can you come again for the other question?
Yes, I asked if you could share an experience.
Yes, that's basically the experience.
Yes.
Because for me personally, I just like I said, I've been using it. So I've been using it for it's part of my lifestyle. That's it.
Okay, I have a message from Sheson here. Thank you so much, Sheson from Bariga. And I think it's one of the reasons why a lot of people do not even want to tap into health insurance. They would rather walk into a pharmacy to purchase anything they need. It's a case of how they get treated, how they get approached when they walk into any health facility. Have you ever had that experience, just basically because you fall under health insurance plan, then you walk into a hospital, they tell you, okay, just calm down, let's attend to these people first, and then we'll attend to you later. Have you ever experienced that?
Yeah, true that. I won't say I've not experienced that. I experienced that during maybe this was like 2019 or so. That's when I started working in a particular organization, and I got this new health insurance company that they subscribed me to. And when I got into the hospital, they told me that I got a bit delayed but the truth of the matter is that's not on the healthcare, that's on the hospital. It's the hospital, just
that's the hospital, not the not the healthcare provider. All right then. So I like the fact that you put that clause there, that clarification there. So Lagos, if you feel dissatisfied about health provider, their service or anything, you can actually reach out to your health insurance provider and then lodge a complaint. If you need to change your healthcare provider, you can go ahead and change. Lagos, Nigeria, you can be a part of this conversation just by putting a call through on 0915-387-7127. If you're not able to reach us via telephone call, please send a text to our WhatsApp platform on 0809-9120-777. But ensure you're not the one behind the wheel if you have to do this, okay? All right, then, moving on now. So, before you subscribed, did you have any doubt about health insurance and how how were you able to how were you convinced or who convinced you on the need to tap into health insurance?
Well, like I said earlier on, I've been using this since I was in university, and that was a long time. But the funniest part, even before university, I'd not been using it, but I did not really understand it, because when you watch movies and then you see in the movies that maybe someone is sick or someone has an accident and they rush them to the emergency unit. These are like foreign movies, and then you hear the doctor or the nurse will say, do you have insurance? Do you have insurance? And I used to be like, what does this guy mean? Do you have insurance? Like, do Americans subscribe to like some type of health insurance? I didn't understand that, but when I go to school and I understood that, okay, this is how it is. This is what they mean by when do you have insurance? Because you just go to the clinic and then do you have insurance? But in Nigeria, when you go to the clinic, they ask, do you have HMO? That's how it is now. We should go to any hospital. Like, I went somewhere because of my cousin that passed away. I went to my family house and I had to go. I was sneezing. Like I said, I used my healthcare very well. I was sneezing. So I went to an hospital that I've never been to before. Yeah. And they were like, do you have HMO? And I was like, yes. And they just had to send a mail to my healthcare provider, and that was it. And I was treated with ease.
So how did having health insurance plan affect the cost of your treatment in hospital?
It's a breather. Let me just put it like that. It's a big breather, because I've never bothered about like, oh, how much is this doctor going to charge me? What's wrong with me? Okay. What's happening? How much am I going to spend? Like, the amount you might, although because personally right now my healthcare has been taken care of by of my organization, so I'm not feeling it. Like, it's not coming out of my pocket personally. So, but at the same time, if I was talking to an individual that is not with an organization and maybe is a self business owner and things like that, I'll suggest that it's something that you prioritize for yourself. Like, you put it as when you're calculating your costs of living. You should just put that, okay, you are going to pay, I think for if can I give an amount?
Yeah.
Yeah.
Fair.
But I think that for a yearly plan that is very good, if I'm not mistaken, you can get a yearly plan for about 200,000 naira.
That's fair enough.
Yes, that's fair enough. That's very fair enough. And then you can also meet with the HMO people, and then you can cut it down to maybe a month. And there are cheaper plans than this one I just said. But I'm just saying the one that takes care of a lot of things that they're not going to be telling you that, oh, your healthcare can't take care of that. So in other case, there's some plans that are very limited to just like the basic sickness like malaria, typhoid, and all of that.
Don't call it basic. Don't even call it basic.
In Nigeria, like if you go to the hospital and they test you now they most likely test you for malaria.
Malaria, right?
I don't know why that is like that.
It's not basic. As basic as it sounds.
I agree.
Yeah, it's not what you think. All right, Lagos. The program is Health Insurance Today on radio here on Lagos Traffic Radio 96.1 FM. I'm still looking forward to your call. You can put a call through or send a text to us. Let's hear from you. What your concerns are with health insurance. I mean, here is a testifier in the studio, and he's just going to tell you how it feels to be an enrollee. He's been benefiting from HMO, and he can share with you his experience. If you have any concern, I mean, we can also help you out, in advising you on how best to handle some of these situations. All right, then, beyond the money, how did you feel like knowing you had coverage during health crises? Would you say health insurance gave you peace of mind?
Yeah, of course. Total peace of mind. Like, just like now, if my wife is complaining about her back, I'm not going to be bothered about anything. I'm just going to be like, go to the hospital, please. Because at the same time, I'm like, nobody's paying for anything. It's already taken care of. Please go to the hospital, go and do a proper checkup. Don't just assume that, oh, your back is spinning you because of the way you slept or something. Just go to the hospital and let them tell you that this is what is wrong with you. There's nobody that is, we're not going to pay for anything. So it gives total rest of mind for myself, for my wife. Like, it cannot be exaggerated. Let me put it like that.
There are two sides to a coin, right? For everything that is rosy, there must be the challenging part of it. Tell me some of the challenges, or at least something you have faced using health insurance that is quite challenging for you, but I mean, it's something that you can overlook, but it's a challenge. It might be a big deal for someone else.
Okay, so to not disregard the fact that yes, there are challenges to some things, because if I was going to say there's no challenges to using it, okay, but the challenges most likely would be for individuals that are not tied to an organization is paying the cost of it for a year, is getting the actual money to start it up. Because some people might feel like they might look at the opportunity cost and be like, oh, maybe I'd rather spend the money on this than spend the money on that. But I mean, you can agree with me that one of the most important thing, not one of the most important thing, if not the most important thing as a human being, is your life, your health. So there's really no challenges for me. Let me be down to earth. If you don't want to experience challenges, do your research before you register on any healthcare provider. You need to do your research. You need to ask people that have used a particular healthcare services, because at the end of the day, there are mediocres out there. We have to put it there. There are mediocres out there, so you don't want to subscribe to an healthcare provider that when you get to the hospital, the hospital will tell you that, oh, your name is not on the list, or you have to wait for, or you call your HMO provider, they will not answer you. You might be there for the next 1 hour, and then they will not, nobody will attend to you, and it might be a case of emergency, which can be beyond more than what it looks like. But just do your research. These are the challenges, so that you don't sign up to the wrong healthcare provider.
All right, tell me why you think every Nigerian, especially those with families, should consider health insurance.
It cannot be overemphasized. Let me put it like that. Your health, your life is the most important thing with you. And then, so, like, that's the first thing. When you understand that your life is very important, your health is very important, how you live is very important, That's the first thing that you need to establish. So once you've established that, you know that, okay, because of that, how do we take care of that aspect? How do I take care of my life? How do I take care of my health? Then there's insurance to cover that. There's insurance that no matter what your financial situation at any point in time is, once you've paid for it for a year or for a particular period, it will be covered. So if you have a family now, your child is sick, and you don't have to be bothered that how much do I have to take the child to the hospital to do the proper care. You just have to take them there.
And this for a start.
Yes, and then, you know, we need to stop self-medication. That's the truth. And if you have a healthcare provider, it will help you. It will save you from doing any form of self-medication. Like when I was the HR of an organization, and an employee would call me that they're not feeling fine, they won't take a day off. I'd be like, okay, no problem, but please make sure you go to the hospital, because we don't want you assuming that, oh, I'm just going to take Panadol and I'll be all right. Like, no, please go to the hospital and then
just medication.
Yes.
Just a pill.
Yes, do a proper health. It's for you. It's not even about the healthcare provider. I'm not here because of the healthcare provider. I'm here as a human being. Like, it's important for you to take care of yourself. So it can never be overemphasized.
All right, then, as we wrap it up on the... Okay, so some people believe health insurance in Nigeria does not work based on your experience. What do you have to say to this?
Like, I understand that. So let me go back to when I said I was working with an organization. We had staffs that they would tell me that they're not using the HMO, that they don't believe in it, and I'll be wondering, like, we're using the same HMO. The HMO that you're using is the same HMO I'm using. Like, what do you mean it does not work? They just don't want to believe that a system where they will go to the hospital and they're not paying for it does not work. It feels like it's not real. I can understand, but at the same time, that's a lie. That's a total lie. Trust me when I say it is. In fact, for people that want to get a job, when you want to get a job, don't agree to work with an organization if they're not going to provide you with health insurance. Health insurance. Don't agree to it. It's part of your salary. It's mandatory. Just like when they deduct tax from your salary, it's part of it. So it shouldn't even be something you should compromise about. It is that important. It works very well. I've been using it since 2010. This is 2025. That's 15 years. And trust me, like, when I want to work with anybody, I would tell them, like, oh, okay, what about HMO? What about HMO? It's so important to me that
All right, then, as we take this home now, what advice would you give to someone listening now who is not sure, or maybe even afraid to sign up for health insurance?
So, like I said already, your life is important. So go on Google, search for the top 10 best health insurance company in Nigeria. Look at their plans and look at the one you can afford, and then call somebody there and register. Just go and register. And I know you might feel like, oh, I might not use it for 3 months, I might not use it for 4 months and all of that. I know how that feels, like, oh, going 4 months and not using it, it feels like it's a waste of money. It's not a waste of money. Go and pay for it, and go for checkup every month on your body. If you feel like you're not sick, just be going for checkup to make sure that everything is all right.
As a spinster or a bachelor, you think you're not using your HMO, it's not useful to you, at least go for checkup. I mean, we'll probably need to discuss the essence of checkups for a lot of people, because as Nigerians, we like to work, we like to run around, hustle without even paying attention to what's going on inside of our body. All right, I must say a very big thank you to you, Adeolu Adeomi, Director, Organizational Development at AT Limited, Lagos, for sharing your personal experience about health insurance with us today. Also, let me say maximum thanks to everyone who tuned in to listen to Health Insurance Today on radio, brought to you courtesy Sister Communications Limited. We hope you found our discussion informative and helpful. Do you know that you can access comprehensive health care cover when you subscribe to health insurance plan today. If you would like to know how to subscribe to health insurance plans for you, your family or organization, or you just want to know more about the topic of today, please call or send a message to 0901 538 8634. You can also email info@healthinsurancetoday.ng. Don't forget to tune in next week, Friday, same time, for information and insight on health insurance. Until then, stay healthy and stay informed. I am Taiwo Baruwa, signing out, but still very much within.
Gets you locked down all day, all time with that traffic report, just as and when you want it, with great music and lots more. Lagos Traffic Radio, your driving companion.
This message is brought to you by Mike Frost and Lagos Traffic Radio at 6.1 FM.
Obey the rules and regulations of the road for your own safety. Know the drive like say you get extra life for house. If you go, you don't go be that. But people know for see you again be that.